Hi, Paul Kelly, veterinary surgeon from Paul Kelly's Veterinary Surgery here in Rathote, County Meath. Again, just a few words just to say about keyhole surgery for bitch spays or ovariohysterectomies in bitches of all sizes. Now, the whole idea about keyhole surgery is it minimizes the trauma. One, the wound is, it can be two small incisions of about half a centimeter each, or one incision of possibly 1 centimeter, a small little wound, as opposed to maybe 2 or 3 inches. So it just decreases the wound. That decreases the pain, the trauma, the stress to the animal. Also it decreases the risk of infection going forward because you've got a smaller wound and maybe you have one suture in it. And also it's much quicker, and so there's less anesthetic. The effects of anesthetic, now most dogs are young when they're having it, but it's the less anesthetic you have, the better. As good as anesthetic monitoring is, it's as good as human monitoring nowadays. But within the keyhole bitch spay, in a lot of dogs, particularly the younger dogs that are sort of 5 to 6 months old, before they've come in season, an ovarectomy, in other words, just removing the ovaries is sufficient. You don't have to remove the womb at all. That will just retract back, and there's no hormonal influence, so there's no risk of getting a pyometra down the road, and you don't have to worry about that. Also, the benefits of operating on a bitch at that age is before they come in season, and that's important. It reduces the incidence of mammary tumors considerably down the road. It might be a few years down the road, but it reduces the incidence like from 24% down to about 4%. It's quite significant, so it's worthwhile. And if you don't intend breeding your bitch, well then I would highly recommend having them neutered. Now again, the keyhole surgery, the basics are, the surgery is basically the same, it does the same, but the main thing about it is it minimizes that wound. The dogs are in great form, very quick, they respond very quickly, the healing is minimal, and sometimes they don't even have a suture. A little bit of tissue glue is more than enough because the wound is that small. So it's certainly something to think about and something to ask for. So thanks for watching, and again, if you have any questions or any queries, you can get me at paul@paulkellyvet.com or 802-7604. Thanks very much.